superficial layer formed with the help of two muscles. First muscle, it is musculus trapezius and musculus Latissimus Dorsi. Necessary to know place where muscle originate, place where muscle attach and function. Musculus trapezius start from occipital bone in the region of linea nuchal superior. It starts also from all spinal processes of cervical vertebrae and from all spinal processes of thoracic vertebrae, and attached to spina scapula, to acromial process of scapula, and to acromial end of the clavicle. What is the function of this muscle? If upper fibers contract, it's pull scapula and clavicle upward. Lower fibers pull clavicle and scapula downward. And if two muscles contract together, they join scapula to vertebral column. Next muscle, musculus Latissimus Dorsi. It starts from spinal processes of lower thoracic and spinal processes of all lumbar vertebrae, from sacrum, from crista iliaca, from fascia, fascia thoracolumbalis, which is below of this muscle, and from four lower ribs, and attached to humerus in the region of crista tuberculi minoris. This muscle performs extension of the hand, adduction and pronation. And also, if we fixed our hand, take something with our hand, we can lift lower ribs with the help of Latissimus Dorsi. It's additional muscle which take place in inspiration, in time of inspiration, breathing. Okay? That is first or superficial layer of superficial muscles. Next, middle layer. Middle layer has two muscles, musculus rhomboidus minor and musculus rhomboidus major. Musculus rhomboidus minor starts from spinal processes of two lower cervical vertebrae, and musculus rhomboidus major starts from spinal processes of upper four thoracic vertebrae and attached to middle body of the scapula. Function, it's pull scapula to vertebral column. And third layer of superficial muscles consists of musculus serratus posterior superior and musculus serratus posterior inferior. Serratus posterior superior start from spinal processes of two lower cervical and two upper thoracic vertebrae and go to upper four ribs. Inferior muscle, musculus serratus posterior inferior, start from spinal processes of two lower thoracic and two upper lumbar vertebrae and attached to four lower ribs. Superior muscle lift ribs in time of inspiration. Inferior muscle pull ribs downward in time of expiration. Next, deep muscles of the back. Most deep muscles of the back develop from dorsal myotome, and that is why they are autochthonous muscles of the back. They develop and stay on the back. What are they? These muscles divide into two tracts, lateral tract and medial tract. Muscles of lateral tract, first of all, it is musculus erector spina. It consists of three muscles. Lateral part, it is musculus iliocostalis. It starts from iliac crest and go to ribs, iliocostalis. Next muscle, it is musculus longissimus. It is longest muscle and it go to the head and attach in the region of mustate process. And last muscle, musculus spinalis, it go near spinal processes of the vertebrae. Function all of this muscle is perform extension of the back. musculus erector spina. Medial tract consists of muscles which start from transverse processes of the vertebrae and go to spinal processes. And they differ only through how many vertebrae each overlap. For example, long muscle in this region, which starts from transverse process, overlaps through 5 or 6 vertebrae and attached to spinal process, has name musculi semispinalis. Next muscle, which starts the same from transverse processes and go to spinal processes, but overlaps through 3 or 4 muscle or 3 or 4 vertebrae. It has name musculi multifidi. And last, or shortest muscle in this region, it starts from transverse process and attached to spinal process of upper vertebrae or overlaps above of 1 vertebra. It has name musculi rotatores. And some muscles in the region of atlanto-occipital joint. It is musculus rectus capitis posterior minor, musculus rectus capitis posterior major, musculus obliquus capitis superior, and musculus obliquus capitis inferior. These 2 rectus muscles and superior oblique muscle start on occipital bone from linea nuchal inferior, and rectus capitis posterior minor attached to posterior tubercle of atlas, rectus capitis posterior major attached to spinal process of the second cervical vertebra, and musculus obliquus capitis superior attached to transverse process of the atlas. And inferior oblique muscles start from transverse process of atlas and attached to spinal process of second cervical vertebra. Another muscles in lateral tract are musculi levatores castarum. They start from transverse processes of thoracic vertebra and attach to ribs. Function, they are lift ribs in time of inspiration. This muscle developed not from dorsal myotome but from ventral. That is why it is not autochthonous muscle. It is muscle which developed from ventral myotome. And last muscles in this region, it is muscles between transverse processes in lumbar and cervical department. In lumbar department, 2 kinds of muscles, lateral and medial, musculi intertransversarii lateralis lumborum and musculi intertransversarii medialis lumborum. Lateral muscles develop from ventral myotome, medial from dorsal myotome. That is why only medial muscles are autochthonous muscles of the back. And in cervical department, present anterior and posterior muscles, musculi intertransversarii anterioris cervicis and musculi intertransversarii posterioris cervicis. Anterior muscles develop from ventral myotome, posterior muscles from dorsal myotome, and they are also autochthonous muscles of the back. And last moment, fascia of the back. On the back present 2 fascia. One of them is superficial fascia of the back. Superficial fascia, it supplies superficial muscles and separates these superficial muscles from the skin and subcutaneous fat. Superficial muscle, fascia, fascia superficialis. And main fascia in this region, it is fascia thoracolumbalis. Fascia thoracolumbalis has 2 layers. First layer, superficial layer of fascia thoracolumbalis, it separates deep muscles from superficial muscles. It is superficial muscle, then fascia, and below fascia, deep muscle. It is superficial layer of fascia thoracolumbalis and deep layer of this fascia, deep lamina profunda fascia thoracolumbalis. It separates deep muscles of the back from muscles of the abdomen. And this fascia present between 12th rib and crista iliaca. Only in lumbar department, here it is. This space occupy deep layer, lamina profunda of fascia thoracolumbalis. That is why musculus erector spina in lumbar department, it's lie between superficial and deep layers of fascia thoracolumbalis, and in thoracic department,